What I do right now with this pencil, I will mark some points. Because when you see this surface, and there are, look, in the volar hand, there are points located we can test. But it's very hard to find them. Easier is, of course, when you have a joint. And the points are mainly located on the transition from the shaft to the capitulum, to the joint. One more thing I like to mention, which will help you with your point location. We have two different skins. One is the yin, one is the yang. The outer is the yang, and there is a different color to it, to the yin. And the yin is what we refer also to the red skin. And there is a line. It always becomes like a natural shade when I look at it. You can see the skin is different right here. You can see this. And the points are pretty much located right of the transition of both of these skins. And as I say, along the shaft and feel it, and there stops, and there's the joint starts, and you feel this indentation. Feel it. Don't be afraid to touch your patient. Just feel these points, and particularly at the beginning. Later on it gets a routine. Later you actually will develop a sense. This will become your extension of your index finger, this probe. Then you really got it. You can feel with it. You learn to feel with it. Just be patient with yourself. It takes a little time. Because of the large surface area, I will mark some points. I give you a little map how you can find this. You remember this was our lymphatic point for the jaw. You make a straight line. You feel here, there's the other joint, and this then straight is the point for the sinus. What do I test? The right side of his body. So this part of his body I test. So it would be the right sinus. I make a straight right angle going over here, and the length of this line should be the width of his thumb. So if you have a big strong hand, it's wider. In a smaller hand, it's less. And here, right straight ankle, there's another point. And I will advance this right now on the screen. And you see here the bronchial point 10. So this is your bronchial point. Now, you see the muscle here, big muscle. Look at this. So it's towards the bone. So you need to kind of, when you want to test this, you have to really push in. You don't go like this, so you go towards the bone. I will do this right now. And now what do I get? A low reading. My pressure wasn't right yet. That's why I got this low reading. So the skin still resists me. So I need to dig myself in here. Here it comes, here it comes. Okay, I don't want to poke him too hard, so I give it a break. Start again. Here we come. Now he's warmed up. Look at this. Beautiful reading. So he's probably not a smoker. No. And he has healthy bronchos. Okay. You see, very simple to find. But if you just look at the hand, find the bronchial point. Not so easy. Now we advance to circulation 8, that's the name of this point, which reflects the venous function of the body. And how we find this? We go right in the center of the hand. And we make a straight line like this. And right here is the point. So you see, you can move the skin. Even if you're a little bit off, it wouldn't make a difference. And here, you go straight down. You push just straight down. See, he responds very nice. And I get a nice, clean reading there. Fine. Good. We advance further, and that brings us to the coronary vessel. Great. Thinking about that we can even test this with this type of equipment is remarkable. And you do not want to say, oh, I give you a diagnosis about your coronary, but we can see the energy in this system. I jump now from the lymph to the lung and to the circulation. But I do this because otherwise I have to constantly go back, forward, back, forward. I'm already have him here. I want to speed this process up. So let me do with one go all the points in the palm. Get it over with. We don't have so much time. We need to advance this. So now I tested the venous function, and the next point is reflects the coronary vessels. Now, if you find an abnormal reading of the coronary, we know how many heart problems we have in America and in the Western world with cardiovascular diseases. Don't make a diagnosis based on this reading. It's an energetic evaluation. It will give you an indication there might be something wrong. If it feels very serious to you, send them to a cardiologist or a medical doctor or to confirm this. You do not want to later make a strong statement according to this test and then be blamed for that something was overlooked. When you move his hand now, there are two creases. The point is located straight down. I will mark this right now at the second crease. That's where it is. Look at the map so far I have. Right ankle, straight in the middle, straight down second crease. That's not complicated. You will remember that. But looking at a plain hand, it's going to be very hard to find. So although I take now a lot of time to explain this, once you know this, I do this in 2 minutes or less. Okay. You set the probe up straight, and remember, no poking. And here we go. What is? Not much. Okay. Use some water. Okay. That's a good reading. And one thing you have to remember, many times when people perspire, particularly lymphatic types, they develop a lot of perspiration and wetness in these creases. And then you get a false high reading. And some people teach, when you test, and I'll demonstrate this right now, use some water and rub it over the hand like I do right now. And then you test, what will that do? Water conducts, so I would not just test this point, I test the whole area, which is wrong. So do not use water and rub this on the hand. And I see some schools teach this. Not a good idea. You just dip the probe in here and you see that little drop. Good enough. Let's advance to the next point. It will represent the myocardium at the heart meridian. It's myocardium 6. Very simple. Straight line between the two tendons right there. Got a little wet here. And straight down, myocardium. Nice reading, good, all right, very easy response. You see, my approach is a little slow because I set the probe first up. I'm not right away poking. Doesn't matter, but when I start pushing, it's a nice curve. You see the line, the top crease here. Between this line and this point, that's where the heart meridian runs. So you make a straight line up here. I'm sorry, it's not a straight line, but it's supposed to be a straight line, okay? And you divide it in 3 sections. So the 3 sections would be 1, 2, 3. Pretty equal. Now on the hillows here, where the muscle is, the top here, and if you advance and you don't know what that point is, just press on this button. And what does it tell you? It says a conducting system of the heart. The conductor. What will that do? People who have arrhythmia, for example, maybe due to lack of magnesium or potassium. So then it comes to mind in your favorites. Once you go there, you check, you see some abnormal reading. Okay, check them with a little magnesium. And all of a sudden you see the value drops to norm. Wonderful. What a great test we did. Many times, if you find abnormal readings here, it can be due to things such as electrical quartz watches. We witnessed that. Some people really have problems with electrical quartz watches because they put little electrical signals out, same like a pacemaker. So therefore, it could influence it. I saw that quite frequently. Another thing is you have this patient coming in and they have arrhythmia, and you see really an abnormal reading, a lower reading, or a drop, or a very high reading. Don't forget to ask them. We do sometimes forget very simple things. How much coffee do they drink? And then you find out, oh, 10 cups, 12 cups a day. And they tell you, yeah, my doctor, he sometimes gives me electroshock to set my heart rhythm straight again. And I said, did he ever ask you about how much coffee you drink? No. And of course, I had patients like this. That's why I mention it. Well, can we do, instead of 12 cups, maybe drink only 3 cups? Give them some magnesium. Coffee is a diuretic. It washes out a lot of your minerals, potassium, magnesium, an important one. Only one point can help so much. Isn't that amazing? Sometimes I hear the question, is it a problem if somebody has a pacemaker to test them? This information, of course, is valuable to know, but I don't think the test itself will not endanger them. Because the currents we use is a DC current, 1.5 volt. It's nothing. It will not stress the body or endanger the patient in any form or way. Dr. Woll also related these different points to different organ systems in a very specific way. You could almost say you can do a differential diagnosis. The following point, which I clicked, reflects the tricuspidal valve. That's very specific already, particularly the right side. On the left side, it would reflect the mitral valve, the tricuspidal valve. Straight down. Remember, I made 3 sections, 4 points, just push down. See? A lot of tissue here. Doesn't let me in right away. Okay, one more time. Here we are. We have a healthy fellow here. Let's advance to the next point, which reflects the pericardium, energetically related to the pericardium. I don't trust this. You see, I think I must have done something wrong. Let me do this again. And I know what it is. I'm not stable with this hand. When I push, his hand gives a little bit, I slip off. Happens, no big deal. Make sure you have a firm position that you feel comfortable too. Great. Good, steady reading. I like it. My approach is a little slower right now. I like it that way because it will not hurt him. So I slowly go in there. We're done with the volar hand. Now we go to the dorsal side.